Stroke Awareness Month is drawing to a close. The Gauteng Health Department is on a mission to curb the number of people who suffer strokes. They've been visiting taxi ranks in and around Johannesburg, handing out leaflets and encouraging commuters to check their blood pressure. Well, we're joined this morning by Professor Feroza Mutara. She's HOD of the Emergency Unit at Charlotte Maxeke Hospital and the Academic Head of Emergency Meds at Wits University, also part of the Angels Initiative Steering Committee. Thanks, Professor. Thanks for your time this morning. Now, very interesting that you've taken this to the major taxi ranks in and around Johannesburg. What exactly have you been doing in terms of stroke awareness there?
Okay, so it's one of the biggest problems, health problems that's going to be and is a rising problem for our health system and for our economy and for our country. So we decided that we need to take this to the people. You know, it doesn't help just doing a whole media presentation and putting it in the newspapers. People don't always see that information. So the idea was take it to the people. And for us, the biggest volume of sort of feet through the door would be at our taxi ranks, especially early morning, late afternoon. So we targeted the big taxi ranks, particularly in Johannesburg at this stage. So we've been to Park Station, the Barra taxi rank, we're doing the Randburg taxi rank and the Midrand taxi rank.
And tell us what you found. I mean, are people out there healthy? Are you seeing high blood pressure? Are you seeing sick people?
So there's a huge problem in the country with undiagnosed hypertension related to lifestyle diseases. The same risk factors that you would have for cardiovascular disease affect stroke. So high blood pressure, diabetes, obesity, high cholesterol. And we picked up a large number of patients who were known hypertensives who had defaulted their treatment, or people who were walking around with extremely high blood pressures who didn't even know they were hypertensive, and we were able to refer them appropriately. So for us, it's primary prevention, which would be preventing the stroke in the first place, and that part of that would be to pick up the lifestyle diseases, to do the education, to do the counseling, to get people to understand the implications of not treating those lifestyle illnesses.
So you do the blood tests, or you do the blood pressure tests, you tell them what's going on with their bodies, and what happens then? When you send them?
So we've had an amazing response, both from the private sector and from the Department of Health. It's a combined initiative with the university, private sector, Boeringer, and the Department of Health has come to the party, which is great. So we've managed to link in the ambulance services and the transport, so that if we picked up someone with extremely high blood pressure, they were taken immediately to one of the healthcare facilities nearest to where we were.
So does this only happen till the end of the month?
So this initiative is because of Stroke Awareness Month and World Stroke Day, which is on the 29th. But the Angels Initiative is an ongoing project. So, you know, we're not going to just do this once, you know, because of the month that it's involved
in. So they'll find you at the taxi ranks and possibly other areas.
And we've piloted it in a few hospitals at this stage, but we will be rolling it out everywhere that we can.
Because we know people's stresses and blood pressure is about to rise, if you heard the budget yesterday.
Absolutely.
So you know. While I have you here, Prof, there's been an alert issued about the Black Death or bubonic plague. Now, do we have a reason to panic and worry? Firstly, what is it, for those who don't know?
Okay, so it's a bacterial infection born usually in rats or rodents, spread by fleas. So you have fleas that sort of feed on the rats, and then that's how humans or other animals would be infected. There's been an outbreak in Madagascar, and we've been placed on alert, obviously because of the proximity and, you know, the risk with travelers coming through. Particularly our informal settlements where there is a high rodent or rat population would be at risk.
Are you aware of any cases here at the moment in South Africa?
Not that I'm aware of, but you know, we would be alerted by the NICD if anything was, and obviously they'd have to test and culture and confirm that diagnosis.
So you can't get it person to person. It would have to be from...
So it would need a flea to spread it from person to person.
Okay. So what are the symptoms, treatments?
So symptoms essentially pretty much like any other flu-like illness, fever, headache, body pains. The one marked feature would be swollen lymph nodes or glands usually initially nearest to where the bite site was.
So you'd have to be bitten by that.
You'd have to be bitten.
And it's not necessarily deadly? Early treatment will...
So untreated it is. The other way that you could get it is inhalation of little droplets from an infected rodent or animal. And usually that causes what they call pneumonic plague, which infects the lungs and gives you a sort of a pneumonia basically, or it would be a progression from bubonic plague to pneumonic plague.
Oh, I'm already itching. Thank you very much for the explanation, Professor Feroza Mutara, HOD of the Emergency Unit at Charlotte Maxeke. She's also part of the Angels Initiative Steering Committee. They're helping people sort of raise awareness about strokes. Thank you very much for your time this morning.
Pleasure.